So what is HCV? HCV or hepatitis C is a viral infection of the liver. It infects the liver either by coming in contact with contaminated body fluids, blood products, or through organ transplants. It will get into your bloodstream, and from there it will enter your liver. It will cause significant inflammation or swelling of your liver, and this is called hepatitis. Going ahead, it could also cause things like cancer or liver cirrhosis, so it's a pretty dangerous virus that needs to be treated. So what is a Hep C test? A Hep C test is basically a blood test. This test checks for antibodies against hepatitis C. Antibodies are just a long word for some proteins that are created by our body to fight against the hepatitis C infection. These proteins are only created when we are already infected or exposed to the hepatitis C virus. So you won't find them in someone who was never exposed. The test, if positive, only tells us that you have been exposed to this virus at some point in your life. It doesn't mean that you currently have it. It only tells us that you were exposed at some point. So how is this test done? It's just like any other blood test. There's no special preparation required. All you need to do is provide a sample of your blood. A lab technician or a doctor will collect your blood sample with a needle and a syringe. They will then send this sample to the lab where it is processed, and you will have the results within a couple of days. In most labs, this test usually provides the result on the same day. A few labs would take a bit longer, maybe the next day, but in a period of 2 to 3 days, you will definitely have the results. In most labs, this test usually provides the result on the same day. So why would a doctor even order this test? And that is the main topic of this video. The main reason a doctor would order this test is a bunch of 5 or 6 different reasons. I'm going to go into each of them in detail, but in short, universal screening. That means there are some places, situations, or countries where everybody needs to be screened for this infection. It could be increased levels of other liver enzymes that were found on another blood test. It could be that you're showing symptoms of a liver disease. It could be that you have certain high risk, you have risks that put you at a higher risk of getting this infection, maybe the way in which you're living your life. And lastly, it could also be that you received an organ transplant somewhere in the late 80s or 90s. I'll go into each of these in detail. Universal screening may be one of the common reasons to get this test done. There are some countries in the world where everybody is tested for hepatitis B. This is more common in Western countries. It is also sometimes done in third world countries or developing countries. Whenever you have to be admitted to the hospital for any reason, they will ask that you get tested for a bunch of diseases, one of which is hepatitis C. Sometimes it is also done for children who were born to mothers that were infected with hepatitis C, and commonly it is also done during pregnancy to make sure that the mother herself is not carrying hepatitis C so that she doesn't transfer it to the child that is to be born. High liver enzymes that showed up on a routine blood test is probably one of the most common reasons why your doctor may suspect that you have hepatitis C, and so he or she may order a hepatitis C test. Elevated liver enzymes, especially the SGPT and the SGOT, both these are just blood tests. They tell us the levels of certain enzymes that are found inside the liver. These enzymes will be elevated if your liver is getting damaged, and hepatitis C, as we know, damages your liver. So if your doctor finds that your liver enzymes are high and he or she doesn't know what is the cause, hepatitis C could be one of the tests that is done to determine whether hepatitis C is an infection of hepatitis C could be the cause for these elevated liver enzymes. So high risk behavior, this is another possible cause. For example, you might be someone who has recently received blood transfusion from a from a center which does not carry out all the proper precautions that are necessary before giving somebody a blood transfusion, because hepatitis C spreads through infected blood. You may have received an organ transplant. Like I already told you, in the late 1980s and the 1990s, hepatitis C infections were very common in people who received organ transplants because proper testing was not done before the transplant. You may be engaging in unprotected intimate activities. You may be sharing needles with others for recreational purposes. All these are termed as high risk behaviors, and all these are modes of transmission for hepatitis C to enter your body. And so if you have one or more of these, your doctor may consider it prudent to get you tested for hepatitis C and may order this test. Probably the most common reason could be you are showing signs of hepatitis. Now, there's no way to tell whether somebody has hepatitis C, hepatitis B, or hepatitis A, but the signs of hepatitis are all common. These include things like yellowing of the eyes, yellowing of the urine, yellowing of the skin, itching of the skin, pale colored stools, feeling very tired, losing weight, getting infected with other infections very commonly. All these are signs of poor liver function, and if your doctor suspects that you have one or more of these signs, he or she may order a hepatitis C test to rule it out as one of the causes. So these are all the different conditions in which in which your doctor may require that you need a hepatitis C test. Whatever it is, please don't delay. Hepatitis C is a virus which has usually got a pretty poor prognosis. Most people are not able to clear out this virus from their system on their own. Medical treatment is almost always required to get rid of this or to control it. It can go ahead and completely fibrose or damage your liver. It can also cause hepatocellular carcinoma, which is a type of cancer of the liver. So this is not something that you delay, that you play around with. Trust your doctor. If they think that you need this test, go ahead and get it done so that you and your doctor can be sure about what is the cause for your symptoms.